Thank you for joining us today for our Retain Kentucky Population Health, Social Determinants of Health, and Community Health Workers' role in the return to work process. I am Kimberly Wickert, and I am from the University of Kentucky Human Development Institute and Retain Kentucky. My preferred pronouns are she, her, hers. I'm a mid-career white woman with blonde hair and glasses. Today, I am wearing a jean jacket and a green and black and white striped dress underneath it. And I have a virtual blue Retain background. I'll review a few housekeeping items before we get started. The captioning feature is enabled, but you can disable it if you wish to do so. We'll be monitoring the Q&A and the chat box throughout the presentation. So please put any questions or comments there so you can join in our discussion today. You will also be receiving a survey following the presentation in the next couple of days. And we really appreciate your willingness to take a few minutes and complete that and provide feedback on the presentation to help us plan for future topics. We're going to go ahead and look at the next slide and just let you know that the information contained in this presentation is intended for informational purposes only and doesn't necessarily reflect the views or opinions of the University of Kentucky Human Development Institute or its individual employees. And we make every attempt to provide accessible, accurate, and current information. So let's move on and talk about planning for next month. Our Retain Employment Seminar Series will focus on providing quality employment services to people living with asthma, and that's on December 14th from noon to 12:30, presented by Dr. Phil Rumrell and Judy-Ann Romeo, and I will put that information in the chat as well. So mark your calendars for that. And we are going to go ahead and look at our objectives. So today we are going to gain knowledge about population health and define social determinants of health and hear how community health workers can promote return to work success. And with that, I would like to ask you to join me in welcoming Jessica Sass, who is the Director of Ambulatory Population Health at UK Healthcare, as well as a nurse practitioner for family and community medicine. She is currently pursuing a Doctor of Nursing practice degree at the University of Kentucky, and prior to this earned a Master of Science degree in nursing from the University of Missouri, Kansas City, and a Bachelor of Science in Nursing from Missouri Western State College. She's licensed as an advanced practice nurse since 2004 and has worked in various care settings that include a critical access hospital in rural Northeast Kansas, providing care in the primary care clinic, emergency department, and inpatient setting, the county health department in the women's health program, an urgent care facility, and a level 1 trauma emergency department. In addition, Jessica completed a fellowship with the Duke Johnson & Johnson Nurse Leadership Program focused on leadership and management skills, the Chief Quality Officer Professional Development Program through the Institute for Healthcare Improvement, IHI, and the Agile Implementation Bootcamp through the Center for Health Innovation and Implementation Science. So thank you so much for joining us today and sharing all of that expertise. We're very glad to have you and look forward to hearing what you have to share with us.
Thank you, Kimberly, and thank you for having me today. I'm excited to share this information with you. And really my intent today is to give you just a high-level overview of these concepts and maybe an opportunity to think a little bit differently about patients, employees, and our community members. So population health really is defined as health outcomes of a group and the distribution of those outcomes within the group. And groups can be anything. They can be geographic location, they can be certain disease states, they can be ethnicity, pretty much anything can be defined as a population group. Here at UK Healthcare, population health was really started in one of the family and community medicine programs, and they were designed to improve patient outcomes. Early on, there was the realization that we needed to focus on the high-risk patient population. And there are really a lot of things that make patients high risk, but specifically the social determinants of health, or SDOH. And some of those examples include economic stability, neighborhood and physical environment, education, food, community and social context, healthcare systems, and all of those go into a patient's health outcome. Life expectancy, how healthy they are, expenditures of the healthcare system, functional limitations. And so I'm going to go back a slide here. It was in looking at all of those factors really that play into social determinants of health that at UK Healthcare, they implemented these population health programs. And as I mentioned, they started in one clinic, but then were scaled across the enterprise. And now the population health program focuses on chronic care management, transitions of care, especially those patients being discharged from the hospital and then going home. There's the social care program that's made up of social work and community health workers, panel management, and then the quality program that's really focused on preventative care, making sure patients are able to get those services. And so when we think about everything that falls into the category of social determinants of health, we also have to think about outcomes. And we know that about 80% of a person's health outcome is related to social determinants of health. So there are socioeconomic factors, their physical environment, their health behaviors. And really about 20% of what I do inside of a clinic exam room affects a patient's outcome. And with that knowledge, we really had to shift our care from the clinic setting to more of an asynchronous care model. And that's where these population health programs really become important. Just a little bit of background information. Again, the social and economic factors and the relationships between those factors are what create the social determinants of health. These outcomes are driven by multiple factors, and the absence of disease does not necessarily mean good health. And that last bullet, I think, is really important. Social determinants of health, or SDOH, contribute to the conditions in which people live and to some extent explain why some Americans are healthier than others, or why some Americans are not as healthy as they could be. So SDOH is really a hot topic right now, especially in the health equity realm. Private and public payers are becoming more invested in health equity, and they have started to implement or recommend programs around SDOH assessment and intervention. And there's good reason for that. The research shows that addressing SDOH can decrease 30-day readmission and hospital utilization, improve mental health, improve follow-up with primary care, and improve chronic condition outcomes. All of those things lead to improved patient outcomes. Also, there's this reduction in medical expenditures as well as a return on investment. And if we can reduce medical expenditures, then for our employers, we can reduce the cost of health plans. Definitely that's down the road, but something to think about. And one way payers, healthcare entities are really trying to improve those barriers to care, those factors that play into the social determinants of health, is through promoting community health workers. A community health worker is a frontline public health worker that's a trusted member of their community, and they have a thorough understanding of the community being served. They are a link between health and social service programs, and they work to promote access to services and improve the quality of care within that community. There are several core roles that a community health worker can really do within their role: the outreach, the home visits, health education, counseling, access, linking them to social services, facilitating group education or workshop, and then really being that support or advocate for the communities. And there are core competencies that CHWs are expected to have knowledge of. So of the public health, behavior change, ethics, community resources, and they need to have the ability to provide health information, facilitate groups, resolve conflicts, and conduct initial interview and assessments. Now, some of you may have heard about Health Bill 525 recently passed through legislation. Language is being written for this, but essentially what it does is ensure that anybody working as a community health worker has certification through the state, but it also allows for reimbursement of those services that CHWs are providing. So that specific language is not completely written, but I think that this is exciting because in the end, it's telling us that the state does recognize the importance of a CHW's role in improving outcomes for our patients, our employees, our community members.
Are they typically nurses or social workers, or what are the community health workers' background?
So it's very independent on probably the entity in which they work. They don't have to have any specific degree or licensure. They really, it's on the job training. So someone who just has an interest in helping others is essentially the role of a CHW. And then depending on how that entity uses that individual, maybe it's for a diabetes program, maybe it's for a nutrition program. So it's all really hands-on. And I think through certification that the state's going to mandate, they'll become a little bit more standard process for background information, knowledge, and then the kind of requirements to be a CHW to standardize that across the state. Because right now it can just be anything.
Gotcha. And it sounds like, based on what you had shared in an earlier slide, that key about being a trusted member of a community is probably, very critical factor in that as well. So that all makes sense.
It's huge, really, because we have a lot of communities that really distrust the healthcare system. And so having someone with that knowledge, that understanding that those community members trust, that can be that advocate, can be that liaison, is huge in being able to provide those communities with the care and access to healthcare that they need.
So thank you.
Mm-hmm. And so I really just want to say that as employers, healthcare providers, community members, it's important for us to think about the social determinants of health and how those factors affect our employees, our patients, our community members, and that we can use our community partners to help all of these individuals have improved outcomes. And one thing about employees is once they lose their employment, they also lose their health care. And then we start to see increased worsening of outcomes. So I just want to really reiterate the fact that we need to think about our community partners, our Retain Kentucky program, our population health programs, our community-based organizations, and even our local extension agencies that have programming that might be beneficial to, again, our patients, our employees, our community members. So even if you just see someone in your community or in your church or another organization that you belong to, these opportunities are there for them as well. And so if you remember, the eligibility criteria for Retain Kentucky is a Kentucky resident, employed in the last 12 months, not applied for SSI or SSDI, and the injury cannot be work related. So not a ton of criteria that would exclude someone from being eligible for Retain Kentucky. And then I can say the population health program works really closely with Retain Kentucky and any of those other entities that those patients or employees might need. And again, the referral process is easy. So that's really all I have. Just a high level kind of think about this when you have a patient or an employee that might be struggling, that there may be other things going on that's affecting what their work outcome is.
That's a great introduction to population health and community health workers. Derek has a question, and he asked if in your experience you've seen a lot of individuals who are reluctant to seek out services to address their health needs due to misinformation, and how have the community health workers been used in areas, and how successful have they been in helping people in those communities?
Absolutely. You know, those factors that fall under the social determinants of health, people don't want to talk about them. Most, you know, a lot of times they don't want to talk about them. They don't want to acknowledge that there's an issue or that they might need help. And so we have been able to, the population health program here at UK Healthcare has 3 community health workers, and we've really been able to create relationship with those patients. Now, I will say some of them have not been quick relationships. You know, they might have been in the hospital 2 or 3 times, and the community health worker will reach out to them each time. And then we've been able to establish that relationship, and we've been able to connect to food, get medications that were too expensive, a cheaper route. We've even been able to get people into homes or apartments that they were coming into the hospital repeatedly because they just didn't have stable housing. And so it does take a little bit of time. This is not necessarily a quick thing when you have community health workers and trying to create relationships and trust. It takes time, but we certainly have had some success stories in that.
Yeah, absolutely. And I know at Retain, we've helped participants and patients script information, because sometimes they get into the situation that they're in with the healthcare provider and they forget what they're supposed to, questions that they're supposed to ask. So I could see, you know, our partnership with the community health workers really just covering all the bases, because, you know, that comfort level with our Retain return to work coordinators and then the community health workers all coming together to help, you know, when they come to see you in the clinic setting and other healthcare providers, getting that information to you in a way that you can then make an informed decision about treatment at that point in time.
Absolutely. And we've even had some of our community health workers accompany their patients to the visit, because the patient said, I just don't understand what they're telling me. I don't know what to do. I don't know what questions to ask. So they've sat down with them, wrote out the questions, accompanied them to the appointment, receive that information, and then they can help the patient process that information after the visit's over and better understand. So absolutely.
As far as connecting people with community health workers, so, you know, we're at Retain return to work coordinators. We have people who are part of the presentation today that are workforce professionals, employers, other healthcare providers I know within the larger systems throughout the Commonwealth, there's, it may be easier to connect with the community health workers, but in general, do you have recommendations as to how we can help people get connected with community health workers?
So probably the best way right now, just in general, is through the health department. They have a couple of community health workers that they have hired to do this work as well. Now, if patients are within the UK healthcare system, then certainly we can reach out to them. And I think there are a couple of other entities that are starting to use CHWs. And I think once the state rolls out their specifications, then we'll see that there are more and more CHWs available to help our individual communities. So we're relatively new, like Kentucky is, I'm going to say relatively new to this. They're in the rural areas much more than the CHWs are in sort of our urban places. So Hazard, Heinemann, they've got a couple of CHWs that have been there working through the Kentucky Home Place program for quite a while now. And so really it's all started more in the rural areas and starting to infiltrate the states a little bit more into the cities, which I think is a good thing.
Mm-hmm. So as far as cost to participants or patients, I know when you and I first started talking and preparing for today, you had mentioned reimbursement of community health workers, but that it sounds like is something that the healthcare systems are reimbursing the community health workers, and it's not a charge to the individual.
Right now, no charge to the individual, and I don't know what the state's going to say. Like, I don't know how they're going to do it. All of that's being written right now. There's a lot of discussion about Medicaid. If you're a Medicaid, not provider, but you are a provider under Medicaid, then these services can be reimbursed. And I don't know exactly what they're going to do. I don't know if they're going to say there'll be a copay for that, or if they're going to reimburse that 100%. So I'm hoping nothing trickles down to the patient. So in one way, I'm so excited about this language for the community health workers and our ability to be able to have more, but I'm also very nervous to make sure that it does not become a barrier, another barrier to care for our patients.
Mm-hmm. Yeah, that's a great point. Are you seeing in those communities that they are available, that they're mostly in person, or are they able to provide some virtual, either telephonic or within a secure platform types of services to individuals?
Mostly it's probably telephonic and like home visits or meeting people in the community. So we were doing this during COVID, and we had to transition pretty quickly because, people were coming in, people were going out, we weren't doing those things anymore. And so we were doing a lot of telephone, but even then, if somebody needed help filling out a form, we might meet them. If it was warm enough, we'd meet them out at a park or something like that. So we were flexible in our programming so that we could continue to help the patient. So I think a lot of it just depends on the patient. Some people do not want you near their home whatsoever. And, we respect that, and we'll meet them wherever, or if they just want to talk on the phone, we'll do that too.
Okay. That's all great information. And I think, this is, this is a great introduction to a topic that probably a lot of us didn't have a lot of information about prior to, and great to know how we can help support our individuals throughout the Commonwealth to be able to, get healthy and stay at work and return to work through population health and the community health workers. So it sounds like it's only going to grow and hopefully be more readily available as it continues to build out and is defined further. So I really appreciate you bringing this to our attention.
Absolutely. And I just wanted to say in the earlier slides, you were talking about the discussion on asthma next time, the employment series next time. And I think that social determinants of health are huge in asthma care. All of the things that you talk about, environment, the geographic location, and the different things that patients are exposed to are huge when you talk about making sure asthma is controlled. And then the medications that go along with that, sometimes they're covered, sometimes they're not. So as you listen to that employment seminar next time, think about too how the social determinants of health play into that disease state and what we could do maybe differently if there are patients, if there are community members, even if there are employees, because there's certainly things that we could do as far as referral or reaching out to retain or population health programs, community-based organizations to help those patients and employees.
Yeah, thank you for that. That's a great point. And we have seen participants at Retain with that diagnosis, and even people who had that diagnosis and then were diagnosed with COVID, which exacerbated, that comorbidity, and have been able to help just with getting walking them through the application process for a disability parking placard, having people learn about the apps that you can get prescription meds cheaper. Even if you have insurance, your out-of-pocket costs decrease. So it really does apply to people with those social determinant of health needs, and appreciate you mentioning that, because our team is very creative in helping people overcome those.
So Derek just put in the chat, I'm not sure what happened to Kimberly, but that there's a lot of people out there that are just unaware of the resources and information that's available to them. And I think that's a large part of it, is that there's so much out there sometimes that people don't even know where to start or where to turn. And then when you start to look at it, you just get overwhelmed because there's so much. And so just having a person, an advocate for you that can help you manage all of that is really important. And then two, I think I'll just mention that even our payers, Anthem, Humana, WellCare, provide all kinds of incentives or resources for patients that I don't even know that our patients are aware of. I'm not even sure if all of us providers are aware of it. And so that's always a good place to look into, is what can the insurance providers provide them if they have insurance, and then if not, then what other places that you can turn to get information for them.